Today, I'm joined by Kayla Fontenot, a speech language pathologist and IAOM certified orofacial myologist. Kayla founded Flower Mound Speech and Therapy Center in 2015 because she saw a need to provide in-depth, personalized services for her clients. Before we get started, we do have some information to share. For the agenda today, we're going to talk about tongue tie release, the controversy around them, what it's like running a private practice for this population, and other factors that you should consider in the oral mechanism. And I do have some financial relationships to disclose. I am the owner of Speechie Side Up and Tassel Learning LLC, and I receive royalties from the Lou Knows What to Do book series. And my non-financial relationship to disclose is that I am a member of ASHA's Special Interest Group 12. And I will let Kayla come on and share her financial disclosures as well.
Great. So my financial disclosures, financially, I am the owner of Flower Mound Speech and Therapy and receive compensation for treating patients privately. I'm a paid mentor for the MYO membership, a paid speaker for Talk Tools, and my non-financial disclosures is I am a member of the IAOM.
Great. Now that we've got all that covered, let's get started. Kayla, thank you so much for coming today.
Thank you so much for having me. This is really exciting.
It really is. Can you tell the listeners a little bit about yourself and what you're currently working on before we get into our topics and questions?
Absolutely. So I am a speech language pathologist since 2011. And I started in private practice back then and began specializing in oral motor and myofunctional type disorders back in 2015-16, and became a certified orofacial myologist and have a private practice in Flower Mound, Texas.
Great. Yeah, I'm really curious, like how you just kind of found your way into this specialty area, but I'm sure we'll get into that. So
Absolutely.
I kind of shared with you before we actually started recording that my almost 10-month-old now, she actually had a tongue tie release at about the 2.5-week mark. And it was such a relief when she got it done. I wish she had got it done sooner, but of course, like as a first-time mom, you're just wondering, like, is there anything else that we can do beforehand? But I think when you're a speech language pathologist and you're trained to look for those things, like I knew at the hospital that it was an issue, that she had, a short tongue tie. She also got the lip released as well. But what are some signs and symptoms that practitioners should be aware of and families should be aware of?
Absolutely. So if we're talking about tongue ties, there are different signs and symptoms across the lifespan that we're looking for. So in babies specifically, one of the most common things that we get approached with for tongue tie or painful latch or just a difficult breastfeeding journey. There are other things like reduced weight gain, clicking on the breast or bottle, heart-shaped tongue. So the baby sticks their tongue out and there's a little groove at the end. Babies with reflux, that they can't seem to solve the problem with reflux. That can be from swallowing too much air, which can be the result of a tongue tie. In an older infant, difficulty transitioning to solid foods because they have a hard time mobilizing the tongue in the mouth or maintaining control of the foods. And then babies that aren't able to take a pacifier, that oftentimes when we do a functional assessment, we find that there's a tie. And then babies that are unable to breathe with their mouth closed, or they're often open mouth breathing, can be an indicator of tie, or could be an indicator of an airway issue or an allergy. So we really like to look at the whole picture and not just say everything's a tie because you have something, on this list. It doesn't mean you have a tie. It just means, hey, let's look a little bit more closely at the whole picture. So you said your daughter had her release done at 2 weeks old?
Yeah, 2.5. And she had everything that you described. The IBCLC that we worked with, the lactation consultant, she wanted to wait, like she wanted to look into the clicking, look into the latching issues and major like GI issues we had going on as well. So we were trying to do like a process of elimination. She didn't want me to do the elimination diet because she wanted me to, I had a major oversupply as well. So we were doing like one-sided nursing, and that helped, but it didn't help enough. And I had spoken to another IBCLC, and she was like, what I find is that parents sometimes just wait too long. And she was right. So like shortly after that, we got an appointment with the pediatric dentist. And he was very upfront. He was like, I can't guarantee that all of the things that are going on, like with GI and all of that, is contributing to or is attributed to the tongue and the lip tie, but I can see it's extremely restricting. And I think it was part of the puzzle, because what did immediately get better was the latch and nursing immediately. Like that day it got better. Which, you know, we could have like probably bottle fed and would have been okay with that. But like you were describing, I was really concerned about her feeding in the future. Like how, if we're having like these issues now, and you could clearly see how restrictive it was. I just was thinking there's just so much more that's involved, and it's probably better to get it done now rather than later. And it was, I mean, she's a great eater now. I'm super grateful for that, because I know it's not always the case, and we're still nursing at 10 months. So it was we actually had to get it re-released, which was horrible.
Oh no. So you had you had a revision done then. What age did that happen?
It was within like the checkup phase.
Okay.
So I can't remember how many weeks after it was, but we were going in every 2 weeks and we were doing all the exercise. Actually, my husband was doing the exercises. I couldn't stomach it. I was like there for moral support, but I ended up doing them after she got it revised. And I haven't looked down there in a while. Like sometimes she'll like cry and I can see a little bit, and I see like the white underneath, but I'm curious to see, like, you know, I'm sure some of it reattached a little bit. It seems like some babies like can go without even doing the exercises and it doesn't attach. I don't know why some have the propensity to like reattach and then some don't, but thought that was interesting.
I think that's a really good point. And you brought up another good point too earlier about oversupply and undersupply. And that's often commonly overlooked when a tie is involved. But the oversupply could be the result of a tie, baby just going vigorously at the breast and mom is overproducing. And then undersupply, same thing. So it's like really hard sometimes to discern, is this from a tie or not? And is a release going to help this one particular symptom or not? So you mentioned the tie immediately helped with latch, but then there were still some other things that you had to figure out, right? So I think that's a really, really good point to bring up.
Yeah, thanks for pointing that out. Yeah, it was just, like I said, a piece of the puzzle. There was a lot going on. There was intolerance issues, which are seeming to resolve themselves now, yay, besides the dairy and wheat, but I think we'll get there. But it's nice that I had like that support team, and I wish that other parents did as well. So I'm really grateful that you are coming on to talk about this, because I know everybody has like, there's a lot of different opinions out there. So I would love to talk about like the controversy around tongue ties and how that impacts like getting proper treatment.
Absolutely. Absolutely. I'll tell you a little bit about my story with my kids with tongue ties, because I think it's important. I'm giving a presentation later this week for Talk Tools about it. It's called Responsive Releases: When to Wait on Getting a Release, and it has a lot to do with maternal response and mental health surrounding when it's appropriate for an infant to get a tie based on the way the mother responds to the infant and that connection with the child. Because as you mentioned earlier, it's hard to stomach some of the aftercare, right? Like you've got a little baby crying, and you're not wanting to go in and do the stretches or cause the baby any kind of distress or anything like that. So I'm excited to be talking about that really soon. But I'll tell you a little bit about my story with my two kids. I have an almost 5-year-old and an almost 3-year-old, and they were both tied as infants. And with my first, he came out. I checked him. The minute he came out, I go, okay, pretty sure he's tied. Breastfeeding's not going so well. I was newer to tongue ties back then. They weren't as commonly treated in our area, and I was doing my best to learn everything I could about them. And I decided to wait on him. I just wasn't quite ready. I needed to find the perfect provider, the perfect scenario. And I waited till he was about 13 months old to have him released. And of course, after the fact and looking back, I go, okay, I should have done that, day one, day two, or somewhere in that very beginning time frame. But I talk about this because I like to illustrate the hesitancy that even as a professional, knowing what needs to be done and knowing what's happening, it doesn't make it any easier. So imagining a parent or a layperson coming in and going, okay, you need to get a tongue tie release, and they're going, I need to do what? Luckily, it's being talked about more, and more people have had them done and had success with them. And, there are a lot of support groups and things like that for people that are going through the process. So that's really great. Love that there's so much support out there. My daughter, when she was born, again, I immediately checked her, and she was like a little piranha. And I went, okay, I mean, she's not even an hour old. And it's like the first thing I do, is check her mouth. And I go, okay, she's really tied. She's like a piranha. Breastfeeding was going, it was dismal. It was painful. It was awful. But I had a traumatic birth experience with her, and I had difficulty regulating my emotions after she was born because it was a traumatic birth. And because of that, I felt that I felt very protective over her. And so I know that even though it's a very low invasive procedure, I thought, well, I do this all day at work with other babies, but I'm not ready to do it on my own. And it took me about 3 months to get there with her and to be in that mental space where I go, okay, I'm ready. It's time. We can do this now. I feel like I'm out of the woods and we can focus on this now. So we did her release at about 3 months. And she had a very interesting release. She was different, like you said, in terms of healing. She healed very quickly, whereas a lot of babies don't heal quickly, kind of like you mentioned. She also produced a lot of saliva during the healing phase, more than most other babies and children that I've worked with. So she had a very interesting healing case. But she did have really good results. She did have some reattachment that we have not addressed yet, but we do plan to work on that down the line when it's needed. Right now, it's not needed, in my opinion. But that's kind of my background story and where I come from as a mom with tongue tie releases. And it's in complete juxtaposition to who I am as a professional with tongue tie releases, because you can talk all day about what optimal function looks like, what optimal outcome looks like. You can help to guide other families and other children into getting those outcomes, but you're wearing a completely different hat when you're a mom. So I like to separate those two things, but also kind of pull in a little bit from each side when talking about it.
Yeah, I think it's so important that you have that perspective, but it is interesting, like you were saying, that even though you have that perspective, the way you treat it is completely different than what you talk about. So yeah, let's talk about the controversy around it.
Absolutely. So I'm sure everybody's kind of heard a little bit of what the controversy is. Does it exist? Is it real? Why are we doing this? Is it really going to help? Is there enough evidence base for this? Is there enough literature for it? Are we getting the outcomes that we want to get? And my answer to all of that is yes. I see it clinically every day, and I have for years. We have an entire clinic that focuses on oral function throughout the lifespan. So we are working with clients that choose to get tongue tie releases. We are working with myofunctional therapy clients all day long, every day. And we are seeing the results that people want in terms of having successful breastfeeding outcomes, having successful bottle feeding and feeding transition outcomes. And then we haven't even touched on older kids and adults yet and what the signs and symptoms of those are. That's really my favorite population, because they can voice why this is so impactful for them and how much this has helped them. But if we want to talk a little bit about signs and symptoms in the older population, we can do that too. I would love to do that.
Yeah, I want to just point out something that you said because I wrote it down before you even mentioned it, because this has been coming up a lot lately in
Hmm.
the pod courses that I've done, is just bringing people back to Asha's like EVP triangle and not
Hmm.
forgetting that circle. I think it's at the top where it says like
Yeah.
client outcomes. And
Hmm.
when you're evaluating any protocol or any therapy technique, that if there are not reports from clients that say this is effective, then you really need to
Hmm.
consider why you're using it. If the research says that it's effective, and I don't want to name any treatment programs out there, but hopefully people
Hmm.
are like thinking about some in their head. There's treatments programs out there that people go to school for that have a degree in that are
Hmm.
not deemed effective by the people that it's actually used with. However, with tongue tie
Hmm.
release, there's a group on Facebook. I don't remember that. Is it the Oral Myofunctional Study Group by Linda
Yeah.
Orofino? Yeah,
Hmm.
Diorofino. There are so many people in that group, professionals, adults who have had it done themselves, and they report significant outcomes. And then
Yes.
there's also research to support it. But a big piece of that is the client feedback, their personal experience
Hmm.
with it. But yes, please, let's talk about
Yeah,
the
I
signs
love
and
talking about
symptoms.
yeah, well, I mean, you were talking about the EVP triangle, which I love because it's literature, client outcomes, and clinical experience. And we do have literature that supports it. And it's like anytime you go to look for literature, you can find literature on both sides, right? So it's
Right.
whichever you do have to look at all of the literature when you're making those decisions, but then you look at client outcomes. And I can tell you, we've had hundreds of tongue tie releases at our clinic, or not at our clinic, but patients that have had them done that we work with. And in terms of anyone ever reporting a negative outcome, it's, knock on wood, it's yet to happen. Nobody's ever come back from a release and said, I regret doing that, or I didn't want to do that. We hear things all the time like, wow, I'm breathing so much better. I'm sleeping so much better. My baby's now able to feed really well. Um, and then, of course, our clinical experience with it just ties right into that. So we have two really strong pillars of the evidence-based triangle. And then we've got the literature side, which I think is pretty mixed. There's really great literature and evidence around breastfeeding in infants with tongue tie release. And then it gets a little bit more into the gray zone when you talk about the older population, older kids and adults.
Okay, very interesting. I'd be really curious to know, and I forgive me for not knowing enough about this topic, but I'd just be really curious to know like what the research says on weighting. Like, do these structures stretch themselves out at some point? Or do people just learn to compensate? I'm sure it depends on the severity of the tie as well, but
Mhm.
yeah, can you speak on that a
I
little
think
bit?
that's yeah, that's a really good point. For a really long time, people used to say that you could stretch a tie. And what we've learned through the literature is that um, the tie is made of collagen and you can't stretch collagen. You can get like the tiniest little bit of stretch. Like that's it. Like that doesn't, it's not stretchy like other tissues might be. What we're actually seeing clinically when you work on these soft tissues over time and you go, oh, look, we can move the tongue a little bit more because we've been working on it. That's just because we've released fascia. That's not because we've released the tie. So I think that's a good point to bring up. They don't stretch. You can work on them and you can get better range of motion by releasing fascia, but you cannot stretch a tie. So if it's tied and it's impacting function, if it's impacting function, it's a tie, period. And we like to keep it really simple.
Okay. That's so fascinating. Why do you think they're
Mhm.
so common? They just, or is it like, it just seems to me that it's pretty common.
I think that's I think that's a good thing to discuss. Are they common? Are they overdiagnosed? Are they underdiagnosed? I don't have the answer to that.
Yeah.
But I think what's really happened is that social media has really picked up in terms of information spread and the rate that information spreads. And so I feel that because we have this information and we put it out there and so many people are putting it out there and sharing, it's really just spreading like wildfire. And we just have access to so much information at our fingertips now. It's almost in your face every day. And I think people are starting to understand the signs and symptoms a little bit more because of that. I know that just even in regular, you can go online, any regular Facebook group, if like a mom group, and a mom says, oh my gosh, I can't get any sleep, my baby's having trouble breastfeeding, you're going to see every mom in the group go, oh, get them checked for a tie, get them checked for a tie. So I feel like that has really brought the general public's attention to the matter in this massive manner. So I think that's really kind of the driving force behind it. Another thing is that because of like things like that too, we've also got access to more education surrounding it, so that you're seeing a lot more coursework being put out there about it. You're seeing people have access to a lot more coursework. Look at all of the continuing education that people were doing over COVID, and we're just getting on the computer and taking CEUs and doing virtual conferences and things like that. So the information is just spreading rapidly. And I think that's kind of the big driving force behind a lot of it.
Yeah, no, that makes sense. I have so many questions, and it's not just for myself because we've already gone down this road. I'm just curious for other people. Like, is there a level of severity in the tongue tie where you make a referral, or like, what are you looking for?
Looking for all kinds of things. I generally shy away from using severity. We do classify the ties. There are different scales that you can classify a tie on, and they usually go like 1 through 4 or 4 through 1, depending on what scale you're using. And for me, it's not about what classification of tie it is. And you'll hear all the time, oh my gosh, the tie was so severe, or hey, we got from a level 1 to a level 4 after the release. And for me, it's not about that. For me, it's about function. For me, it's about, is the tongue doing every single thing that it needs to do in the mouth? And do we need a tongue tie release in order to get it to perform more optimally? And I hope what I'm saying is making sense.
Yeah.
So please jump in and ask questions if it's not. But I am looking for the ability to, if we're talking about kind of the older kiddos or adults, the ability to isolate muscles in the tongue, use them with graded movement, meaning that we can move them through space smoothly. Protrusion and retraction, lateralization. Are you able to lift the lateral borders of the tongue? In an infant, that might look like, okay, they're tied, so they're not able to lift the lateral borders. Do we need to work on feeding therapy skills to get that to lift? Or do we need a tie release in order to get more of that mid-blade elevation so we can compress against the hard palate? It just looks like all different kinds of things for every mouth. Every anatomy is completely different, but those are kind of the basics of what we're looking for, just optimal function.
Okay, that makes sense. And then last question I would say related to these is, who are you typically referring your clients to do the tongue tie release with?
Yeah, so we've got a really great network because we're so lucky. We're in Dallas, the Dallas-Fort Worth area. So we have a lot of great skilled providers in our area. We do work a lot with dentists, and we work a lot with ENTs. It really depends on the parent's preference. We kind of say, here are the options. You need to choose based on your circumstances, what you think will be the best for you. And we can help guide you through that and talk through some of the pros and cons after you discuss that with the providers.
Okay, great point. So can this type of therapy, oral myofunctional therapy, be done in other SLP settings, or do you feel like it's primarily geared for private practice? Like school settings, or?
I think it can be incorporated into school settings. I think it's just going to look a little bit different because, we're in school-based settings, you're working towards how does this improve their education? So I think if you've got a client like with an articulation disorder like S, I think it would be paramount to use oral facial myofunctional techniques with those clients in a school setting. And it might look a little different than private practice. We have pretty much free reign to discuss and talk about all things medical, but in a school setting, it's can be difficult to say, hey, there might be a tongue tie at play and that might need medical intervention. We do have a lot of school SLPs that will refer out to us in private practice because it's just a zone that they can't speak to, and they can say, hey, mom, I think you might need to look into this. Here's where you can go for this kind of treatment or to have this looked at, but they can't really talk about it much. But in terms of the actual therapy techniques to maybe elicit that correct S, they can do the techniques all day long. And they can still potentially even get a good S sound without a tongue tie release. It really depends on the case. You have to look at all aspects of it. So that's a tough question to unpack.
Yeah, no, I think your answer was perfect for it. Let's see. So you've built your private practice in your current area. What if someone is interested in getting certified in this therapy technique and building their practice around it? What tips do you have for them?
I started, so before I was in SLP, I started out as an SLP assistant, and I had an excellent supervisor that was really well trained in talk tools therapies and oral motor techniques, and that was something that I was taught in school to avoid. And so I remember I resisted it, like as an assistant. I had so much resistance because it had been kind of like beat into your head, like, don't do this, don't do this, don't do this, it doesn't work. And she had been a therapist for quite a long time, and she was an excellent teacher, and she had excellent outcomes with her patients. And I saw this over time, and I went, maybe she's onto something, but I just don't know yet. And I remember the following year I was out on my own, or in a private practice, and I was going, wait a second, I see a kid who I think that would be perfect for. I think they need to I think we need to figure this out. And I kind of got the CEU bug at that point. And I just started taking all of the coursework that I possibly could around anatomy, physiology. How do the muscles work? Why do they need to work a certain way for speech to sound the way we want it to sound? And then things around chewing and swallowing as well. So I really got my basis from Lori Overland's feeding course, and looking at the feeding side of things and seeing how do the muscles work for feeding, because that's where I was most comfortable with it, right? Because I can do oral motor all day for feeding, and that's okay. But then if we talk about it in speech, we go, oh, it's not okay, right? But it took some undoing and some unlearning and some relearning to get me there. So I started down in the feeding route, going, okay, how much can I learn about how oral motor impacts feeding? And then I go, okay, so if they're feeding and they're doing all of these things on the feeding hierarchies, they're doing all these motor skills for feeding perfectly, their speech is starting to look really good too, as a result, of just focusing on the feeding. So then I started kind of developing my own patterns and how to treat kids, looking through the lens of both. And then, we found orofacial myology, and we go, oh, okay, well, this makes sense, because that's exactly what they're doing, and it has a name, and we've been trying to reinvent the wheel all this time. And like, we found our home. We're so happy. We found a group of professionals that see this the way that we're seeing it, and it was really validating. So that's when we got into orofacial myology and everything that entails. It's been a long journey. It's been a long time getting to this point. I've had this business in Flower Mound for about 6 years now. So October 2015 is when I opened this location, and we're now 7 or 8 SLPs that are all working on oral function. It's amazing. So
that's great. Congrats.
Yeah.
That's
Thank
awesome.
you.
So when you're looking at the oral mechanism, I know you mentioned some of these factors that you look to consider. What are those? I think you talked about allergies, like other areas that people should be looking at.
Yeah. So when we're treating a client, or if the client comes in and says, hey, we want myotherapy, and what are some of the things that we look at in our evaluation or talk about with our parents? So actually, I can just kind of walk you through what an eval looks like. We look holistically at the patient. So we are looking at, I'm first of all taking a lot of pictures. Okay, so they'll come in, and I'm taking a picture of what does their face look like at rest. And when I'm looking at that picture of their face, I'm looking, Are their lips sealed? Where are their asymmetries? Do their eyes line up? Is their smile even? Is there tension, or is there tension in certain areas? Like if you look at their chin, is it bunched up? Is it dimpling? So that's just what I'm looking at in pictures. I'm also looking at just their posture and just the way that their head is positioned over their shoulders. Are they able to sit up nice and tall and straight, or does that head kind of come forward from kind of hunching over like this all the time? So I'm just looking at everything, kind of taking a note of it. We do look intraorally as well. So just looking at structures, we're looking at dentition. We're looking at the way the teeth might be tipped one way. Are they kind of flaring out of the mouth? Are there spaces between the teeth? Do they tip in? We are looking at function of the tongue. So the way that they manipulate the bolus to form a bolus, to swallow. I'm looking at the way the tongue lateralizes, protrudes, retracts. If the way the borders lift, can they do all those things again with grading? Is their jaw moving when their tongue is moving, or are they able to stabilize their jaw and move their tongue independently? I'm looking at, is their nose clear that day? Do they have allergies? Can they breathe through their nose? We do like a little test to see if they can nasal breathe. So we'll have them hold water in their mouth for 2 minutes and try to breathe through their nose, because they'll say, oh yeah, my mouth's closed all the time, and kind of might look like they are, but they're sucking air in secretively, just not doing it in a way that's not so obvious. So we'll do like a little 2-minute test. I think that's something the Breathe Institute teaches too. Or we'll have them hold like a sticky note or a popsicle stick in their mouth, hold it together to keep their lips sealed, to make sure that they're not, or to make sure they're able to nasal breathe. And I love the 2-minute breathing test, especially because when you have them either take out the popsicle stick or spit the water out, I always look for the first thing they do after they spit it out. And are they just gasping for air at that moment? And that's the sneaky part, because most of them, they'll take it out and just go, okay, like they couldn't really breathe all that time. Like they were just doing what they could to perform for this test, but they really weren't breathing well through the nose. So when we do things like that, the next step in that is usually a referral to an allergist or to an ENT to check out their nasal airway. So we're looking, again, it's a holistic type of treatment. We're looking at all different kinds of things. So oftentimes there are multiple referrals involved, and working with an allergist or working with an ENT to clear the sinuses, clear the nasal airways, manage the allergies. That's all really important, because one of our overall goals is to be nasal breathing 24/7. When you're awake and when you're sleeping. The other things that we're looking at, are we able to rest the tongue and the palate to stabilize the rest of the face, or keep the rest of the face in harmony? So if we've got our tongue suctioned up in our palate, we release all of the tension through here, through our masseters. We release the tension through our chin, our mentalis muscle, and our tongue is just kind of holding the jaw up in space. Should be like maybe the teeth are either slightly touching or a millimeter or two apart, and everything's just resting gently. When our tongue is not holding the jaw in place, what's holding the jaw in place? We're clenching, or we're using these accessory muscles to hold the jaw up so that we're not open mouth breathing all day. So we're just looking at all of those things and deciding, what's at the root cause of this, and how do we get you from where you're at to lips closed, tongue sealed in the palate, and breathing through your nose. So those are our 3 big goals. Okay.
I will share a personal story. I was a mouth breather that I didn't know about. I wasn't aware. I mean, I knew I was, but I didn't realize how much it was impacting me. And last year I got nasal surgery, and it was life-changing, literally.
Wow.
And it's just amazing. How long I compensated for not I could actually work out after that, and be able, not be completely winded after just getting started. It's just, and I would have so many sinus infections, and I don't know what came first, the chicken or the egg, but since then, knock on wood, it's nothing, but it was constantly an issue, always having sinus infections. Yeah, I can smell things. Like,
You can
I
smell
didn't realize
things.
I wasn't smelling things before that, which,
Oh, that's
now having
great.
a baby and changing diapers, maybe I could go back a little bit to not smelling. But no, it's a whole new world. So I
It
definitely see
is.
what an impact it makes from a client's perspective.
It absolutely, I was my first myo patient after I learned about orofacial myology, and I self-treated and had amazing results. And I show my before and after pictures, if I can say this, on my Instagram, of the way that becoming a nasal breather actually changed my facial structure entirely. I just remember being like, gosh, like probably 11 years old and aware that I couldn't breathe through my nose. I remember sitting in class going, okay, I'm just going to close my mouth and try to just do this. And I was bored in class, and I remember practicing and going, okay, I can't do it, but how come everyone else can do this, And I was a chronic mouth breather, chronic allergies, just like you, just always had a sinus infection, was constantly just having to treat that. And as a result, the way that my face grew was my my mid face didn't develop as much as it should have. It didn't grow as forward as it should have. My jaw was very retrognathic. So if you looked at me from the side, it was just the jaw was kind of tucked back in. And after about a year of learning where my tongue was actually supposed to sit in my mouth, it was like night and day difference when you take a picture of my profile, when you can see that the jaw just sits forward naturally, and it released all of this tension in my chin, and it released tension through here. I used to have TMJD as well, and that's resolved. Migraine headaches, things like that, as a result of clenching and grinding at night, resolved. And I actually did have a tongue tie release last October, which further changed the way that my structure looks if you look from photographs. But it also released so much tension through my neck and through my shoulders and through my back. It was phenomenal.
Wow.
Like, no regrets on having that done. It's like you see other people and you help other people with it all the time, and then you finally get to go through it yourself, and you're like, wow, this is life changing. This is
Yeah.
amazing. So yeah.
Thank you for
Yeah.
sharing that. Yeah, I mean, you can definitely speak from personal experience about the effectiveness. So, wow, that's incredible. I'll have to check out your Instagram. Is it far back?
It's actually, yeah, let me see. I don't think it's that far back. It's maybe like, yeah, it's about 15, 20 posts back right now. So
Okay.
yeah, you can see I did like a side by side. So I did a before, and then I did after just myo, and then I did after just myo and frenectomy. So it's like a 2-year time lapse.
Okay. Very
Yeah.
interesting.
Yeah.
My last question, this is more of just like a recent, actually, I've had two of these cases in my short career, like 7 years so far. Do you ever see clients that have no lingual frenulum, like at all? Or is it just like, no? Okay.
It is, it is something that can happen. It is I know it's an extremely rare thing to not have a lingual frenulum. I mean, I think the last time I looked, I think it was like 1%, but don't quote me on that. It was a really, really small percentage. I think what happens sometimes is that the frenulum can be submucosal, and it can just be really hard to tease out, or there are just so much compensations with the floor of the mouth lifting that it's just, we're not able to see it when they suction their tongue to palate. So while it's completely possible, I haven't seen it. I've seen it in photos, like other people have come across it, but I have not personally seen it.
Okay. Yeah. No, and it kind of goes back to what you were saying, that you're looking more at like the functionality. Like
Mhm.
maybe they don't have one, or maybe it is submucosal, but how is it actually impacting like everything else? That's the
Exactly.
most important thing. Okay.
Mhm.
Is there anything else that you want to share about tongue ties, about this type of therapy before we wrap up today?
Yeah. So let's just, we can just briefly go over signs or symptoms that for an adult that might have a tongue tie.
Okay.
Because I know I touched on this a little bit in my story, but temporal mandibular joint dysfunction, or some what people call TMD or sometimes they'll call it TMJ, but it's TMD, and just any kind of joint pain, clenching or grinding your teeth, sleep apnea, chronic reflux, again, that heart-shaped tongue or having a groove, neck pain, and then picky eating and mouth breathing. So all could point to needing an evaluation for functionality of the tongue.
Okay. Thank you for
Yeah.
sharing those.
Yeah.
Very helpful. Great. Well, you talked about your Instagram a little bit, but can you share where everybody can find and connect with you if they are interested in learning more?
Absolutely. You can find me on Instagram at _SLP.
Great. And just so anybody can look for it, it's FONTENOT for the last
Yes.
name.
Mhm.
Perfect. All right, Kayla, thank you so much. This has been extremely informative.
Thank you so much for having me. That was a lot of fun.
It's great. Until next time.